Hi guys, Cliff Olson, Doctor of Audiology and founder of Applied Hearing Solutions in Phoenix, Arizona. And in this video, I'm talking about the link between tinnitus and suicide and the 4 different treatment options that you can use to successfully treat your tinnitus. Coming up. The relationship between tinnitus and suicide got thrust into the national spotlight when the founder and CEO of Texas Roadhouse, Kent Taylor, ended up taking his own life in March of 2021. And according to his family, tinnitus may be one of the main reasons why he committed suicide. While the number of tinnitus-related suicides is unknown, it is speculated that as many as 1 out of every 6 individuals with tinnitus has suicidal thoughts. Tinnitus, or tinnitus, is otherwise known as ringing of the ears, and it is very common, especially in individuals who have hearing loss, who comprise 90% of individuals with tinnitus. In fact, one of the most common theories about why people develop tinnitus is the absence of sound that makes it from their ears to their brain. So if you happen to have hearing loss, it creates a situation where your brain is not receiving the full amount of auditory input, and it ends up creating its own phantom sound to replace it. According to the Centers of Disease Control, in the United States alone, approximately 15% of the United States population has tinnitus. This equals about 50 million individuals. And of those individuals, approximately 2 million of them have debilitating tinnitus. While the majority of individuals with tinnitus can easily ignore the ringing and buzzing, it is the individuals with debilitating tinnitus that literally suffer from this condition every second of every day. If you were one of those individuals with debilitating tinnitus, then you already know that it can dramatically impact every aspect of your life. Whether you're at home in a quiet room trying to read a book, whether you're at the office trying to get work done, or whether you're just trying to fall asleep at night or stay asleep at night. I myself have tinnitus, but it does not negatively impact every aspect of my life, so I cannot truly empathize with everything that you're going through. However, I have treated a number of patients inside of my clinic who have debilitating tinnitus, and it's so severe that they're borderline suicidal. The reason I say borderline suicidal is that I've never actually had a patient attempt to take their own life after they've reached out for treatment. This is largely because there are a variety of different treatment options that can significantly reduce or even eliminate your perception of tinnitus. Basically what I'm saying is, you do not need to commit suicide to get relief from tinnitus. You need to find an audiologist who specializes in tinnitus treatment so they can provide you with guidance. Now, there are a variety of different tinnitus treatments out there, but there is no one single treatment that's perfect for everybody. So you have to find the treatment option or treatment options that help you reduce the perception of your tinnitus. But before I get into these options, if you could do me a huge favor and click that like button, it helps videos like this one get in front of individuals who need to see them. And while you're at it, if you have not yet hit the subscribe button with notification bell, this ensures that you never miss one of my new videos. That being said, I really appreciate it. Now let's go ahead and get into those treatment options. The first potential treatment option is hearing aids. If you happen to be one of those many individuals who also has hearing loss in addition to your tinnitus, then hearing aids can be one of the absolute best ways to reduce your tinnitus, because 6 out of every 10 individuals who use hearing aids to treat their hearing loss also get a significant reduction or complete elimination of their tinnitus while they're wearing those devices. Now, I know that treating your hearing loss isn't really high on your list of priorities if you're watching this video, but trust me, hearing aids can be an absolute lifesaver, literally. How does this work? Well, remember the theory that I was talking about earlier, where it's the absence of sound making it from your ears to your brain that actually triggers this internal response of your brain making this tinnitus sound? Well, if you can restore sound back to the brain, oftentimes you can shut off that mechanism. Hearing aids also have tinnitus maskers built into them, which can be customized to drown out the sound of your tinnitus, and these also happen to be your second treatment option. Tinnitus masking is basically when you play an external sound to either drown out or mask over the perception of your own tinnitus. You do not need to have hearing aids to use a tinnitus masker. You can either run a fan in a room, you can buy a noise generator, something like the snooze that you can customize the audio of that masking sound to drown out the perception of your tinnitus. You can even use a regular set of earbuds and then play sounds from the Starkey Relax app on your smart device to drown out the perception of your tinnitus. Not only does tinnitus masking work really well throughout the day, it works really well at night in order to help you fall asleep and stay asleep. If these first two options of hearing aids and tinnitus maskers don't work on their own, then you need to strongly consider the third treatment option, which is professional therapy. Some of these professional therapies include cognitive behavioral therapy, progressive tinnitus management, and tinnitus retraining therapy. Cognitive behavioral therapy, otherwise known as CBT, is a form of psychological treatment that is used to treat a variety of problems, including depression, anxiety, drug abuse, eating disorders, and of course, tinnitus. This particular therapy is designed to help individuals control their negative emotional reactions to their tinnitus. Progressive tinnitus management, otherwise known as PTM, just like the name suggests, is a treatment plan that progresses to higher levels of treatment depending on the specific needs of an individual. This particular type of tinnitus therapy is endorsed by the United States Veterans Administration, and it incorporates a variety of different treatment options, including CBT, as well as ear-level devices like hearing aids. I will actually attach the PTM workbook in the description below if you want to check it out for yourself. Tinnitus retraining therapy, otherwise known as TRT, is a form of therapy designed to train your brain to habituate to the sound of your tinnitus so you no longer focus on it. It also includes psychological therapy, often administered by an audiologist, as well as relaxation techniques and stress management techniques. There is also a fourth option, which I would consider to be the new up-and-coming therapies, like bimodal neuromodulation from companies like Neuromod. The theory behind bimodal neuromodulation is that by stimulating multiple sensory pathways, that you would be able to modulate these neurons that are causing this perception of tinnitus. In the case of Neuromod, you would actually place tiny electrodes on the tip of your tongue that stimulate the trigeminal nerve while listening to specific sounds through a pair of headphones. In a clinical trial that I will link in the description below, tinnitus sufferers saw a significant improvement in their tinnitus severity with this bimodal neuromodulation treatment. And these improvements lasted for up to 12 months post-treatment for 80.1% of the trial participants. I think my point after presenting all of these different tinnitus treatment options is that suicide should never be considered the solution for tinnitus. There are many audiologists out there who really know what they're doing when it comes to tinnitus. You have to reach out to them and leverage their knowledge and their treatment abilities. So if you are having suicidal thoughts because of tinnitus or anything for that matter, you need to stop what you're doing right now and pick up your phone and call for help. If you live in the United States, you can call the National Suicide Prevention Lifeline 24 hours a day, 7 days a week at 1-800-273-8255. If you live outside of the United States, go online and find the number for your National Suicide Prevention Hotline and give them a call. When you're done talking to them, go ahead and reach out to an audiologist in your local area who can help you work through your tinnitus treatment options. Suicide is never the answer, and in my opinion, if Kent Taylor, the founder and CEO of Texas Roadhouse, knew how many treatment options he had available to him and all the professional support that he could have received for his tinnitus, I truly believe that he'd still be alive today. That's it for this video. If you have any questions, leave them in the comment section below. If you liked the video, please share it. And if you want to see other videos just like this one, go ahead and hit that subscribe button. Also, feel free to check out my website, drcliffaud.com. And if you are having thoughts of suicide, please reach out and ask for help.